Hello everyone. Here are some of my thoughts about Professor Geek's challenges. For me, his main challenge for the next steps for his HIV study, the main challenge is to decide what he wants with this next phase, what he wants to discover, what he wants to prove. Because he needs this reference to decide at what point of the research process of discovering a new treatment he is. This is the main challenge because it seems he's not understanding at what point of this process he is right now. His main concerns at first appear to be first, do no harm to his patients, and this is noble. But at the same, he seems to be confused about he seems to be having more the worries of a clinician who wants desperately save a patient and is emotionally involved with that situation. And he's looking like more this way than looking like an experienced researcher who also wants to cure and to support the patients, but thinks in a more structured way on how to discover more strong data that could have more validity and ultimately be transformed into a therapy in the future. He should consider in his decision, he should think about many things he's doing right now, and all the colleagues addressed these points. Like one colleague said, he should try to predict possible risks and benefits, balancing them. Renata said that. For example, he should think about if the benefits outweigh the risks. He should think if the previous results are enough data. Shouldn't they do a preclinical study? And it was also said that obtaining consent from the patients should be an important part of the process, and he should think if their informed consent were public, how people would react to his informed consent. I also think that he should consider in making the decision if he really needs to take the risks to make a huge transition from a very small study to a very large 15-year study. If he's not trying to work this concept of translational research too fast. In order to support this, I'd like to share some more points of reflection. It's very difficult to understand in what point of the phase of a trial is he right now, or he wants to go in the next step, because he doesn't have a preclinical, and how he's going to approve a phase 1 study, or because it seems like a phase 1 study without a preclinical data. If it's a phase 1 study, or he's going to approve a phase 1 study, what did he do? If he did a phase 1 study, shouldn't he have at least 20 subjects? Shouldn't he have more data? And shouldn't he had chosen HIV patients which are not treatment resistant, because he wants to use a therapy to discover a therapy and later use that therapy to a larger population. If he starts studying a population that it's not the most part, that doesn't represent the most part of the patients, because it's some of them who are not, who have 2 different regimens of drugs, 2 failures in drug therapies, it's not the majority of patients. And he studied this population of patients, these 5 subjects in this situation, and how to go further to another phase, starting with data from 9 months to 15 years, starting with 1 dose, going to 6 more dosing, 6 infusions rather than 1, and how to make patients stop their who are healthier. He says he wants to test in a healthier population, and if they are healthier, they must be well treated, and how to take the medications out of that population of patients for 15 years with so few data, if that therapy can really work. It could put the patients at the risk of very harmful infections and risk of even risk of death during this period. And another thing that caught my attention, it was that Dr. Cameron, even though in the end he said that maybe we should think more about our study, maybe it's not the time, it's good. Before he said that he uses a statement to compare the gene therapy with drug therapy. Oh, gene therapy is better because there is in gene therapy you don't have the toxicity that you have with drugs. But how could he affirm that with so little data? It seems to me that it reflects the leader of the team, one of the fellows, the assistants, are acting in a certain way, like his tutor or his leader, in a way that not considering at the, let me think how to say it. It seems he's not understanding how serious it's the statement he's doing. At the same time, it's the same reflection for Professor Giggs. It seems he's not reflecting in the way he needs to reflect to do before doing such a huge step. And I'd like to also to thank you everyone, and to thank you Jillian for the report of death regarding a new medication and the death concerns related. It's really interesting because it's as in the Gelsinger case, once something goes wrong, every minor issue that you forgot or you didn't realize, or for a reason it was not seen at the right time or it was not reported, every single mistake will be addressed, will be criticized. And if you have a good team, such Professor Gigs have, maybe being more acting in a slower pace could certainly make them achieve their goals, but they need to go step by step. I'm sorry about the length of the video, and thank you.